first. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now the Texas pledge. Honor the
Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
And then we'll have a brief reflection. If you would, please bow with me. Dear Heavenly Father, we just come before you tonight thankful for all the blessings that we have that you provide us, Father. Thankful for this county, this area, this life that we are able to have here in this city and in this county. We're thankful for this hospital, Father, for the doctors, the nurses, everyone who's here that takes care of us, Father. And we pray, Father, that as we meet tonight, as we look at the things that are the business of the hospital, that you give us the judgment, the wisdom to do the right things, Father, that we continue to have a strong hospital here to take care of our brothers and sisters in this county. It's in your Son's name we pray. Amen.
Amen.
All right. Next up on the agenda is the roll call of the board. And we'll start out with Marcelo Villegas, absent. Dave Pettis.
Here.
Jeff Jordan. Present. Addison Lambert.
Here.
Larry Richardson. Here. Joshua Warner. Absent. Tom Miller. Present. Kay Day. Absent. We have a quorum, so we may proceed. Next up is the approval of the May 16th, 2019 board meeting minutes. Those are attached. If you would please take a look at those. And when ready, we'll vote on approval.
I move that we approve the April summary and financial analysis as, is it April or May? It's May.
No, it's the board meeting minutes, not the minutes.
Board meeting minutes. Oh, sorry, that was April. Sorry. That was
A second. Okay, I have a motion by Allison Lambert, second by Jeff Jordan to approve the May 16, 2019 board meeting minutes. All in favor? Motion carries. All right, next up on the agenda then is citizen input. We have no citizens here to provide input this evening, so we'll move on to item number 6, which is introduction of personnel.
Well, the first person, I'm pleased to announce we've been in a search for Consolata to have an executive director, and we found one, Veronica Colazo. She's going to be,
It's an O at the end.
I'm sorry, it's an O at the end. Many of you may actually have met Veronica. She is the events coordinator at Luz, and she handles all the marriages, all the events, everything. Whenever you go there and there's events, she's on top of things. She's had numerous years of sales, and she's always been involved in the golf tournament over the years, so she's graciously come on board and already hit our Denim and Diamonds. So with that, can I just have you say hello and tell us a little bit about yourself?
don't know, do you want me to come up or from
You
here?
come up, we
No,
can
no,
do it
from
from
here,
there.
it's okay. So I'm a resident of Floresville. I moved here from California. But I always tell people, please don't use it against me. I'm not crazy. I'm not a crazy Californian. I love Texas, and that's why I'm here. And I just fell in love. I came to San Antonio, but I wanted to live in a small town, in a small community, and looked around, and Floresville just felt like home to me. And I just love the community that I live in. I feel more at home. I often tell this to people, I feel more at home here than I do at home. It's just everybody was just so hospitable and helpful and made me feel like part of the community. So I love it here. I don't have a background in medical at all. Fundraising, just kids. I have 13 and 14-year-olds, so schools are always having fundraisers, to supplement, for the teachers and stuff. So that's something that I have experience with. And I did do sales, like my whole life. I've done retail, and I did sell for almost 10 years the Rainbow Vacuum Cleaner, door to door. So I told Bob if I could sell a $1,500 vacuum cleaner to somebody that...
You know that sold her, right there. That sold her right there.
So, you go into someone's house and they don't even know what the heck they're looking at, and then you show them something and you believe in it and you show them how much you love it and what it can do for them, and then you walk out with a check or a credit card transaction. So to me, early on when I first moved here, I had to bring my kids to Connolly, and I've always stood up for Connolly because all of my experiences have been great. I'm very grateful that the hospital is here, and I've always, expressed that to anybody that may be saying something negative. In the past, I've always, I'm very proud of this hospital even before I became part of the team. Just like with Luz, I started working at Luz, but I had been a customer for a long time, and people see me and they talk to me about it and they're like, gosh, you're such a good salesperson. And I say, no, I just love, our establishment, I love our product, and so I feel that I can do the same for Consolata. And I just started and I'm really excited, so I really do need your support. We're starting a little bit late with the event, so if you can help us with sponsoring a table, silent auction items, if you have any contacts for me to go visit, like I'm not afraid to go knock on doors and get in, talk to people face to face. I just really want this event to be successful. Alton says we need to sell 100 tables, so that's our goal. And of course, does everyone know what our goal for this event is, what we're trying to raise money for? We're looking to purchase a Lucas mechanical chest compression device. I understand the hospital doesn't have one, and we feel like it's something that's needed. And so we would love to be able to raise that money and much more to be able to pay for that. So with your support, I'm sure we're going to make it happen. Does anybody have any questions for me?
I don't, thank you.
Thank you.
So you'll be seeing her around.
You had the good sense to come to Texas, so that's a plus.
Yes, thank you.
You got here as fast as you could.
I definitely did. I did.
When is the event? How much are the tables?
Oh, I'm sorry. Okay, so the event is August 3rd. The tables are $500, and you get your business name. And this year we're going to do something different. We're not just going to type a generic name for your business. We're actually going to type the logo that you provide to us, or we'll just check out your website and copy and paste. So your logo goes on the table. The tables come with 8 tickets for you to use for your customers or your staff. The breakdown is $65 per ticket if you sponsor a table. And you get dinner, margaritas from what Alton said, margaritas all night long. 2 drink tickets, of course, chips for gaming. And then you get entered, everybody with their ticket gets entered into a drawing for a trip for two to Las Vegas for some real gaming. And it includes airfare. And between that and then our silent auction, so if you can, sponsor a table. Also, we're looking for like special auction items, unique things. I know some of the things in the past, the Viagra, which I saw it on the list, and I'm like, oh my gosh. I'm like, do we really auction off Viagra? Oh my gosh. And then Bob had to explain to me it's a rooster. So you just never know what people in Floresville will go for. So if you have something unique.
We need to educate them.
Yes.
What kind of Viagra?
Yeah, so there's usually a fair share of rifles, deer feeders.
Right.
Most years seems like there's
Artwork.
some kind of vehicle.
There's artwork in there.
Yeah,
We'll have a
artwork.
lawnmower, we'll have,
I bought a chainsaw one year.
you bought a chainsaw.
You
one
did.
year,
I did.
And they go fast.
I did.
And it's really funny here with Agro. 3 of your guys came for lunch today. I hope I'm not gonna disclose. Were you there?
Yeah, I was
That was you.
Yes.
I was gonna hit them up. And I was gonna hand you a flyer, and I came by and
Who's the boss?
Okay. Well, okay. So if you see me at Lou's, I do approach my customers at Lou's, and I was this close to bringing you a flyer, but I'm like, you know what? I'm just gonna go visit them later on.
Well, I'll help you with.
I hate to admit it, I have no idea where Lou's is.
Awesome. Thank you.
Golf course.
At the golf
Oh,
course.
okay.
That's the restaurant at the golf course.
Oh, I got you. Oh, we tried to go there one time and it was closed.
Mondays and Tuesdays were closed.
Yeah.
I'm sorry.
Okay.
Yeah, and you have to put in the GPS to try and find the place. It does not know where it is.
There's a lot of turns,
Yeah.
to the neighborhoods.
Yeah. And no street signs.
So Consolata unanimously voted Veronica in. We're very excited. She's here with our marketing team, weekly basis, getting everything going, and so we're just pleased to have her on board.
Thank you.
Well, Brandon, you gotta meet that one, but the next one, I've already introduced in finance, but some people have.
Grace wasn't here.
Yeah, Grace wasn't here, so I'm gonna let you know. Brandon McDowell, he's new executive director. He is taking my place, and he was the HIT project manager here for the last 6 months. He was the chief information officer previously for us, and he also held the dual role of the healthcare strategic advisor. He also served as director of IT applications at Forest Park.
I just got to ask, who named the medical center Forest Park?
You'll know.
Sir?
I was just thinking a medical center, Forest Park. I think a Forest Park is a cemetery.
Well, it is a
Depends where you go, it could be a cemetery.
It's a cemetery.
It's a cemetery.
They're all back there.
Depends how you look at it, yes.
No, we can go to Forest Park Hospital.
Not many people
Not
do anymore.
everybody.
Yeah, I know a lot of people didn't.
Well, Brandon came on about 2 years ago with us through ICE Technologies, and it has been a pleasure to work with him. We have made great strides, I believe, together, and with his leadership in IT, we share a like vision of where we need to go and where we need to be, and we've been working hard. And so I think that my success as a COO was getting a few departments at a time and making my headway through those departments. If you had given me all the departments and home health at once, I would have probably floundered. And so that is our goal right now. And so he's assuming an executive director position, and he has 4 departments as of right now.
4 or 5.
4 or 5, yeah. Tell a little bit about yourself.
So I guess I'm a transplant as well, but not as far as California. Come from Dallas via East Texas. So born and raised in Longview, into Dallas, and went to school there. Married my wife there. Have 3 kids, so we'll be moving down. So we're looking for a house down here. Been in healthcare for about 20 years. Started out in a community hospital in Denton, then
was a transition there to THR, Texas Health, and worked at Baylor at the time, now Scott and White. So definitely been in larger systems, Triad hospitals at one point before they were taken over. So big systems, but also in a community health, rural health region. So definitely know that space as well. So hoping to bring my expertise and knowledge as I can to help the group here and do what I can to keep Conley going on the path it's going on.
Good deal.
Thank you. Welcome.
Thank you. So
Glad to have you. All right, next up is review, consider, and take action regarding the following issues. April summary and financial.
April or May?
No?
It says April, but is it April or is
May?
it May? It's May.
Okay.
That's what I was looking at.
May summary and financial analysis.
Thank you. For the month of May, we had strong month for our inpatient admissions. We had 77 admissions for the month. That equated to 288 patient days. That drove our patient census up to about 9.3 patients per day, which was a good bump up from where it was previous month and where it was in May of 2018 as well. ER, almost 1,000 visits. We had 985 visits for the month. Good admissions out of our ER for the month at 8.3%. Strong lab and radiology visits for the month. It was down slightly from prior month, but still well above budget. Surgery procedures for the month did drop down a little bit at 77 procedures. However, our GI procedures had a record month at 432 procedures. That was over 108. That was over 100 procedures above our prior year number, and 83 higher than we saw in April. Strong gross revenue for the month. We were above budget in both inpatient and outpatient revenue. Inpatient revenue was 8.7% above budget, and outpatient was almost 11% above budget. At the end of the day, after expenses, we did miss our budget by $81,000. When you look at the net income from operations, however, on a year-to-date basis, we are $418,000 ahead of budget. During the month, some of the expenses to note were the salaries and wages. They came in $189,000 above budget. When we dug into that, some of the departments that stick out are physical therapy, home health, skilled therapy. This is a department where year-to-date, we are seeing 33% above budget when we look at our revenue. We're also seeing huge numbers when we look at the number of visits that we budgeted. We're 28% above prior year when we look at our therapy visits, and 32% above prior when we look at our nursing visits.
So expenses are going up, but as is revenue.
As is revenue.
Based on patient.
Now, there is also a budgeting discrepancy in there when we look at our estimates that we use when coming up with our budget for that department. We did miss the mark a little bit. So there's two pieces. There's the budgeting piece, and then there's the exceptionally high volume, which is driving the actual expense to be above the budgeted numbers. The emergency room, year-to-date, 5% over budget when you look at revenue. That's almost $500,000. The big departments that have huge variances, radiology and lab. Radiology is over 9% above budget. When you look at revenue, and lab is 15% above budget. So the increased volume is contributing to the budget variance, as well as inaccurate estimates in creating the budget. We also have some departments when comparing to prior year that we didn't have in the prior year. That total a little over $900,000. We have IT, our South Campus, and our rehab, which were previously subcontracted employees. Employee benefits is coming in significantly above budget. That is due to our higher than expected self-insured claims that are coming through from our self-insured insurance plan. We did have an audit adjustment that got reversed in the month of May. We chose to leave that adjustment in there in order to ensure that we're going to have the correct liability moving through the summer months to pay the claims that are coming in, and we'll watch that closely.
Is the increase in claims, is that a trend or is that just an anomaly?
Hopefully it's an anomaly. You have good years and bad years when you have, self-funded plans or even a fully insured plan.
I think last year you did a little better than you thought.
We did. Last year was a good year, and so because of that, we were able to get some better rates. And so what we're waiting for is for our stop loss insurance to kick in the current year. It's just hard to predict what your claims are going to be. So we're seeing a little bit of an increase over what we saw last year. Hopefully not a trend. Physician salaries were slightly over budget due to higher volumes at one of our primary care offices, Dr. Henry. Payroll taxes coming in slightly over budget, however, in line with where you would expect your payroll tax percentage, right at 6.5%. Contract labor was $12,000 over budget. This was all from our ICU department. We had to engage 2 full-time agency personnel for nighttime shift. We have successfully hired 1 full-time and are looking for 1 more. Our payments to physician were under budget, over $55,000. We came in under budget for our ER subsidy program for ER physicians. Our Lavernia physician was under budget, as was our ENT physician. Purchase services were slightly over budget due to the fees that we pay for the collection of funds from our self-pay after insurance patients. Supplies only slightly over budget. That came from chargeable supplies through our clinics, through our orthopedic clinic, and one of our primary care clinics. Our repairs and maintenance was $42,000 for budget. We had some significant boiler and HVAC repairs that totaled over $30,000 for the month. MRI maintenance, CT scanner, and a little increase in utilization of our clinic EHR system. Rental expenses slightly over budget with the addition of the new campus central location. And our other expenses coming in under budget, almost $40,000, due to some expenses that were budgeted but not utilized during the cash, very strong for the month, over $13 million, leaving us at 144 days cash on hand, still very strong. We did fund $136,000 during the month to participate in the URIP program, which provides an additional bump in our reimbursement from our managed Medicaid payers. In June, we are also funding our DISH at $92,000, and then in July, we will be funding our district program. So those will help us significantly as we go through the summer months. We do have some more repairs coming in the month of June, I think. We have another boiler that we are repairing. We're estimating that to be about $18,000. So we'll expect our repairs and maintenance to once again be a little bit hefty. So we are taking a good hard look at our summer staffing as we head into these summer months and preparing for a little bit lower volumes as we go through the rest of June and into July and August.
have any questions? Not, as the acting chairman of the finance committee, I can tell you that the finance committee recommended to the full board that they approve the April summary and or May summary, excuse me, and financial analysis, and I so move. Yeah, am I allowed to make a motion?
Not really.
No.
It needs to go to.
I'll move.
Yes.
I'll
second.
move, yeah.
Okay.
I'll-
All right,
I can-
Alice.
Yeah, I can,
You want to be the,
well, it's up to you, because I don't know how that works. Would it be better if I did it? Or-
Yes,
Okay.
chairman's chair.
I'm
Yeah,
not supposed to.
yeah, when you're in this role.
Rescind my motion.
Okay.
Okay, so you're motioning?
Mhm.
And you're second. Okay,
Second.
motion from Allison Lambert, second from Larry Richardson to accept the May summary and financial analysis. All in favor? Motion carries. Next up is the retirement plan trustee update.
We had listed as our trustees with One America, the previous CEO, and a member of our management company. Now that we have a new CEO and CFO here, we would like to switch the trustees from Jeremy Riney and Curtis Rojas to Bob Gillespie and Kyle Klein for the One America.
Okay. And did the finance committee,
They recommend that for approval to the full board.
I'll make second. I'll make a motion. A motion by Allison Lambert, second by Jeff Jordan to update the trustees on the retirement plan to the current CEO and CFO. All in favor?
Is this a 401K type plan, you know, that's the
Here.
committee? Or is it
Similar, it's not a 401K, but because we're a taxing district, we operate under a 357B.
Okay.
Next up is the Endeavor Conway Employees Quality Performance Compensation.
As a reminder, twice a year, we have an incentive to reach a high star rating with Medicare. And so all hospitals in the country submit data. There's over 100 measures that we are compared to our peers, and then we're given a rating. And so in our agreement, twice a year, in December and June, we report to you what our current star rating is. And if we're able to achieve 4 stars, it's $30,000 twice a year, and 5 stars is 50, or 50 stars achievement would be 50,000. Bob has assembled a 5-star task force that's working diligently to improve all our indicators, looking at issues with documentation, provider orders, those kind of things, making sure that we're doing everything we can to meet all the core measures, and all the patient satisfaction is a big part of this. 20% the star rating, so working on that. So they were updated in February, so we are still at the 4-star level. You can also, well, I'll tell you that in a second. So Dr. Pravena suggested when this was approved that the staff also benefit from the quality incentive, and so the board agreed. The staff gets the equivalent amount of the bonus that Endeavor does. So if you're a full-time, part-time, or pool team member in good standing, you would be able to participate in this award. It's prorated for the time worked, so if you only work 3 months, you get half the bonus, as an example. Of course, it's only awarded if we achieve the 2 highest levels. And then once it's approved by the board, then it'll be paid out within the next month, so that it's timely. Kyle estimates each time for us, it's roughly that amount per each full-time member and part-time pool, but it will be probably slightly more to them, so they'll have that on the check. The idea is to get them aware and putting our money where our mouth is. We want our team to be quality, and if they achieve that, they get the quality incentive. Next slide. So the hospital website, if you'd like to go see all the measures and our star rating, is called hospitalcompare.gov. They also compare Medicare plans and home care agencies. a way for a consumer to go and look and see how their particular hospital is doing. So with that, you can also see the facilities in our region, and I'll call these out by name. But
Please do.
Conley and the facility just southwest of us are the only 4-star hospitals in the region. 31% of the hospitals in the nation are 4 stars, and 25% in Texas, so we're in the top 4 hospitals in Texas. The big systems in San Antonio, which start with B&M, are 3 stars. They have one license that they all work underneath, so all their hospitals, except for like the one southwest of us under Methodist, is in one license, so they're rated collectively as 3 stars. And then Otto Kaiser to our south is a 3-star. So 45% of the hospitals in the country are 3-star, 53% in Texas. And the county hospital in San Antonio is a 2-star, and the one just to the north of us, if you want to go over to 123 and go up to Scottsdale and up, is a 2-star, which represents about 15% of the hospitals in the nation and 11% in Texas. So we believe we've achieved this, and we're asking for board approval for the Endeavor incentive as well as the community incentive for the policy you all approved.
And this is just a hospital,
Yes,
not a clinic system.
correct.
And,
These are all
in our
hospitals.
home health care, like 4 or 5 star?
They're 5 stars.
Okay.
They're the only one in the state. That's 5.
When we get to be 5-star,
Yes, sir.
Yes, sir.
which is next quarter, I would say, or next.
Before December.
Yeah.
I think, I see the 4 stars on the billboard and so forth, so I don't think the public knows what that means.
Exactly.
And I think we need to have some sort of a campaign to make them understand the quality of this hospital. I mean, there's only 2 in the region.
Big deal.
It's a big deal. That's a
Thank
big
you.
deal.
In some of our promotional and marketing efforts, for home care, you put the 5-star stuff on there.
People just don't understand, they're used to 5-star, and they don't understand how significant 4-star is, and
Right.
we need to explain that a little better.
Yep.
And what it means to them. And what
And
they
then,
have
and when you
at
hit
their
5-star, we'll stand on top of the building and scream and wave.
fingertips. Have stars everywhere.
Yeah.
I'm gonna hold you to that.
Okay. No, I said we. I will if you
The
will.
royal.
I'll do it, I have no problem.
It's the
Y'all can hold
royal
on to
we.
each other on top of it.
All right. What did the finance committee recommend?
I move to recommend approval of the Endeavor Connolly employees' quality performance compensation.
I will second.
Have a motion by Allison Lambert, second by Larry Richardson, to approve the Endeavor Connolly employees' quality performance compensation based on the achievement of their 4-star rating. All in favor? Motion carries. All right, next up, we will talk about capital expenditures and service agreement, lease agreements. First up being the Advanced Sterilization Products Services Service Agreement.
The advanced sterilization handles our Evotech for GI procedures and urology. It cleans all the scopes. So last year's was right at about that much. The age of the equipment has is increased, so there was about a $500 increase to that total price after negotiations. So we're asking for a year service agreement with advanced sterilization at $20,580.
And last year was about 20,000.
Yes, it was right around that same price.
What's the recommendation on the finance committee?
We move to approve the capital expenditure of the Advanced Sterilization Product Services Agreement.
I'll second that.
I have a motion by Allison Lambert, second by Jeff Jordan, to approve the maintenance contract agreement with Advanced Sterilization for $20,580. All in favor? Motion carries. Next is the ENT microscope.
So this one I have noticed, it's been brought to my attention, this one is under $10,000. so I'll leave it up to y'all to vote for. But the ENT microscope, our service agreement usually runs around $6,500, $7,000. We've got this one negotiated through another certified company that can actually handle the microscope services. Ray was very diligent about that, and so note or you can act on this for that service agreement at $3,500.
I'm gonna call for it.
What did the finance committee
We,
recommend?
to approve the capital expenditure of the ortho microscope service agreement.
I said ENT.
That's a type of
That's fine.
It works for both.
Works for both.
All right, since we did that vote in finance, we'll do it here as well. We have a motion to approve the ENT microscope service agreement of $3,500. Do I have a second?
Yes.
Motion by Allison Lambert, second by Chris Pettis. All in favor? Motion carries. Next up is the Texas Department of Agriculture grant for ACVO? Vocera. Okay.
So this is a Texas Department of Agriculture offers grants every year. They ask that hospitals put up a certain amount of money along with them to get the grant, and it meets certain criteria. I'm actually, just if I can take a moment and just say how proud I am. Pam McGrew and the staff, I think Dr. Profetta may be involved in it. They got a handicap grant in December for our hospital and for the HBO wound care. And so we're focusing more and more on grants. This is one that came up. So Texas Department of Agriculture grant, Valerie Vick, our quality director, and a number of team leaders got together and applied for this communication device through Texas Department of Agriculture. They are agreeing to put up around $61,000 if we put up around $25,000. This is communication devices for all of our staff. It can be handled in codes. They still have to announce overhead, but they can communicate codes, rapid responses, just so many. Respiratory, can you come to ER? Stat. They're looking for a nurse who's taking care of patients and they're not sure which room she's in. They can communicate, we need you immediately at the nurse's station. It's a great tool to have, and so we are looking at a full system communication. We're even looking at some parts that could actually communicate with doctors through text messaging with this grant. It's over $80,000 in total, so we're asking for approval for our portion of this grant at $25,000.
What did the finance committee recommend?
To approve the capital expenditure of the Texas Department of Agriculture grant.
Okay. Second. We have a motion by Allison Lambert, second by Jeff Jordan, to spend the our portion, the $25,000 to acquire the Vocera communication system, which will be subsidized by the Texas Department of Agricultural grant. All in favor? Motion carries. All right. Next up is the Healthcare Corporation Services Group, EBS contractor. This is for housekeeping?
Housekeeping. Environmental services.
Okay.
That's their new name. So currently, Healthcare Services Group, and Carl and I were discussing that in finance. I think it was around 2011 and 12 when we did the original contract. There's been no increase and percentage increase year over year for them. They are having trouble finding staff. We've gone into serious negotiations. They handle our hospital, OR, 497, the L-shaped building, MOB as we call it, Lavernia and North Campus. South Campus was acquired by, when we closed Post and stocked out, that those combined services went to South Campus. So in this contract negotiation, we also picked up our 495, that's our front building, and the central campus that we are leasing to maintain those services and floor care too as well. It is an increase of about $89,000 picking up those two buildings and bringing them up to a contract, if you will, to pay their staff at a reasonable rate at which they can hire. So a significant increase to the staff members as well to a living wage if you will. So we are asking for an approval of a contract, yearly contract with Healthcare Services Group, ACSG, at $450,000.
Will we be able to validate that they do actually
Yes,
pass
sir.
that increase through?
Yes, sir. We'll be able to validate that.
Most of those staff people are local folks anyway.
Yes, sir.
Yeah.
They are.
They live in the area.
They do. We've even hired some that you have hired in the past.
Oh, really?
Yes, ma'am. That's good. Very
What
good.
is the recommendation of the finance committee on this?
Did they use me as a reference or what?
I walked over there to Central Campus and they were, hey, here's our card on a piece of paper. Y'all have jobs.
That's professional.
We had jobs.
I make a motion to approve the capital
Sorry.
expenditure of the Healthcare Corporation Service Group.
I second.
For $450,000.
A motion by Allison Lambert, second by Bruce Pettis, to approve the Healthcare Corporation Services Group EBS contract for $450,000. All in favor? Motion carries. All right. Next up, we're going to move to the annual and quarterly board reports. First up is the infection control plan. Andy?
Let's see, I got papers for y'all. Yes. Thank you. So these are just two of the annual plans we have to get approved. One is quality improvement, one is infection prevention plan. Not much has changed. I'll quickly go through. It's already been the policy and procedure committee and approved. We just need the final approval from the board. The quality improvement plan, really all that changed on there is a few additions. We have the infusion clinic that we started officially a couple of months ago. So we added that to the quality, which means they will report to our monthly quality meetings. So that was added on page 4. Page 5 of 6 is they just added some of our reporting entities into that for quality as well. And that's it on the quality. So everything has remained the same except for the addition of those. Now we need a motion to approve the quality plan for 2019.
By the way, thank you for doing the text thing in there so we can see what changed.
Yes.
I think we brought that up last time, that we couldn't tell what changed, and they obviously went in and did the review function so the new stuff shows up for us. So
I'll make a motion that we approve the quality improvement plan for 2019.
I second.
okay. Have a motion by Jeff Jordan, second by Grace Pettis, to approve the quality improvement plan for 2019. All in favor? Okay, motion carries.
Second one is infection prevention plan. Sue updated this. If you go to page 2, this is the committee. So once again, we've added some extra departments to the actual committee to include some more people from the nursing unit, quality assurance, and housekeeping. Housekeeping is a huge part of the infection prevention, so we added them to the committee. On page 3, she added sterile processing and business office / call center. And I think that's it. In reference, page 6 of 6, just to show y'all, this is the quality improvement committee. What is an indicator and the reason for the monitor, just for your information. There's no changes to it though. And I need a motion for this one as well.
I'll make a motion we approve the infection prevention plan for 2019.
I'll second.
Motion by Jeff Jordan, second by Larry Richardson, to approve the infection prevention plan for 2019. All in favor? Motion carries. All right. Next up is clinics and call center campaign. We have, oh, there she is.
Hello. So,
We just wanted to go over some of the things we're doing in call center. Our service level has been at a consistent 95, between 95 and 97%. But we still have patients who call in and really don't understand all that the call center can do. So marketing is going to help us get out to the community everything that we can do in the call center. And some of the things that we're going to change is basically, we don't want to call it a call center. We want to call it something along the lines of a patient service line where we can help you with other things than just an appointment. Because I think a lot of the feedback we're getting is, well, I just want to speak to my doctor. I don't want to leave a message. I don't want to speak to the nurse. I want to speak to the doctor. And when we get down to the actual message, it's, I need a refill request, or I need a referral, or I need an update on my paperwork. And a lot of that stuff we can answer at this level. And it just benefits because you can get the answer right away. You don't have to wait for the physician to call you back or the staff. And sometimes the physician doesn't even know the status of some of those items. They order it, it goes through, and then we have a team of people working on that. And so the physician may not even know the status of some of that paperwork or the referral, which then they'll get their staff to call you back anyway. So we're trying to put something together with marketing's help that we can send to the community and say, these are all the things that we can help get complete when you call us. We are doing some training in the call center. We are sending the call center representatives down to the clinic so that they can work with the physicians, they can work with the staff, kind of get to know some of the protocols that they want. So right now we're still in training phases. It's gonna take a little bit. We want to make sure that when we do put this out to the community, we're ready. We want to make sure that we can answer your questions. So there's a lot of training involved in that right now. So for example, we're doing a refill protocol where a family practice physician has agreed to say if the patient calls in and they've been seen within the last 3 to 6 months, it's okay to refill without an appointment. Or they need an appointment in 6 months, but give them 30 days. So it's little things, protocols in that we can just have some autonomy or do these things on our own without having to go through the physician. So this is kind of a flyer, an example, right? So prescription refills, we can update you on your lab and imaging results. Doesn't mean we can give you results, but we can tell you if they're in. Sometimes the physicians will leave a note that says they're abnormal or they're normal or everything's good. So if that's in there, the call center, the representative can give you that information. But if it's more specific, we want to leave that to the physician to call you and give you results. But we can tell you if they're in. And then of course, physician messages, sometimes they just have something urgent they want to talk to. We can get them through the back line if it's a real emergency. And then I think this is just some of the stuff I already talked about. So we can give you updates on referrals, refills, if you're requesting a new medication and status on paperwork. We don't want patients to think or waste time if they want a new medicine. Because sometimes the doctor, we already know is not going to prescribe it. So we need to make you an appointment if you want a new medication. But there are some medications that the doctor says, we'll give them a couple days and make an appointment with our nurse practitioner, or they can come in if they're not feeling any better. So we're trying to get some of those protocols within the clinics so that we can better serve the community and not having them wait to get the physician to call them back, or we want to just continue the first call resolution, which is what our goal is, to reserve your issue the first time you call. So, yes, ma'am.
Are they finding that the patients are being just a bit too demanding?
A little bit. Well,
no, I mean, let's be honest,
it's
because
not demanding. They're not giving us, or they're not giving the representatives a chance, I think. They want to speak to the person in the clinic. They want to speak to the nurse that they know very well because they go see Dr. Henley, every 3 months, and they know Kelly, so they want to just talk to Kelly. But we can take care of some of the things that Kelly can take care of at this level. And if we can't, then we will absolutely get to Kelly, for the answer, or Dr. Henley.
Well, and on the recording when they're holding, doesn't it say what y'all can help with? Because sometimes when it's not answered, immediately, I thought that it might be.
You know what, that's a good point, I'm not sure that it says.
I thought that when I've been on hold before, I thought that I heard that, but it could, but I hear so many things about the hospital that.
Right.
Maybe
I'm not sure, we'll have to check that.
Yeah.
To see if the tree does
A lot of
that.
sites, like if you try to call Sprint or something, try to push you onto their side. Did you know that you can?
And that's what
you
I'm
know,
thinking that I heard,
Yeah.
that these are some things that our call center can help you with. That's what I think I heard, but I could, maybe it was.
Yeah, and it's more
Hold on
of
for
those
something
types of things, like we had a patient call, refused to talk to anybody about the physician, it was a Friday afternoon, so they were gone. It took her from like 8 in the morning till 6 o'clock in the afternoon, and at 6:30 we were able to resolve it, when she finally said, this is what I need. We're like, well, we can do this for you right now.
You were on the phone the whole time with her?
Patient was calling back and forth,
Oh, okay.
trying to get somebody, but wouldn't tell us what
Why?
she needed. She just wanted to speak to that one person. And we finally got to her. So we can do this for you right now.
Yeah. It was resolved within 15 minutes.
Yeah. And so it's more of just giving us a chance to help you, being a little bit more open-minded to the staff that's working in the call center.
So we gotta get the message out, and that's why we're not gonna call it call center anymore, and I'm not sure that's gonna be the name. but-
I think it's gonna be patient
You think it is?
services, patient
That's,
services line.
yeah, I like that.
We did like patient health line, but what we didn't want is for patients to think that we had, like a nurse line. Because when they think health, they'll think, well, I'm gonna call a nurse and tell them what my issues are, and it's more of a patient services line, yeah.
And it utilizes Conley's primary main number, correct?
The 1400
Yeah.
number, yes, and it'll give you the tree, and then the clinic is, there's an option for the clinic, so.
And instead of calling the girls representatives like other traditional call center, we're thinking of giving them a different name, like clinic patient liaison or something like that.
Concierge.
Concierge.
Exactly,
Well, concierge make more money.
Ours is
They're gonna wanna raise it.
Yeah.
Better not say concierge.
I got a French.
It's all right, every time y'all tell me something,
You
we're
bring it up.
looking at, and we're bringing teams together, and we're coming up with resolutions.
Good.
So we're listening.
We like that.
Well, it is kind of hard to help people understand that others can help them, where in the past you would just call the office directly and
Right.
talk to one of the gals there, or the guys, and they can tell you, well, yes, this is your appointment, or this is you can get another refill, or whatever. So it's an educational opportunity to help them understand, we can do this for you, but if it's necessary, we can switch you over to the office, but we can do this. And, for people that are not used to that, it's gonna take them a while to understand that.
Right. And although our patient service level is at that percentage, because we're answering the phones and we're taking messages, we really, even if we take a little more time with the patient, that service level may drop just a tad bit, because we're doing more on the phone for these patients. We'd rather take that extra minute or two
Yes.
to get the issue resolved, and so that the patient can be happy, and they don't have to call us back or wait for the physician. Yeah.
Are we seeing any increase in the use of the kind of the portal where you can make your own appointments? Is that increasing?
We've seen an increase in activity. So patients are going in, they're logging in, but they're not going any further than that.
They're not filling out the paperwork.
No, they're not filling out the paperwork, they're not sending us messages. So what we're trying to do is send them messages so that they can reply through the portal. And maybe they'll get used to it that way. But they are logging in, they're just not utilizing. Now, the appointment line on Hilo, we see some activity there. So they're requesting appointments through Hilo. But as far as their medical patient portal app, there's not much engagement in that yet.
The one thing I hate the most about going to the doctors, when they hand me a clipboard with 6 sheets on it and say, fill this out, and I'm like,
None of them have.
yeah.
There's so many things.
Yeah. And I'm like, I don't remember how many surgeries I had or when they were.
So,
Been a while back. That's the answer, a while back.
While back.
Yeah.
any other questions about what we're doing with the call center or the patient services?
I think training the staff is very, very important. I think
Yes.
that's how to handle people, and so, but I think also we got to train the public a little bit. That's gonna take a little while.
Right, and that's where we are right now. We're training the staff. We want to make sure that when we do kick this off and it's full blown, that they are ready to answer questions. But you're right, it's also training patients. And, they'll call us for prescription refills, and really, we need them to call their pharmacy for the
Yes,
prescription
yeah.
refill, and that's just a big disconnect with patients.
Well, and
that
it
kind of
clearly
education.
says on the, to call, you know, for
Yeah.
refills, call this number, so
Right.
it's. you
Or the
know,
bottle tells you this is
And that
number
kind of
one,
tells you that you're
yeah.
working with,
Right.
Mhm.
you know, society-wise, you're only gonna get through to a very, you know, to a certain percentage. If they can't get that
It's just
part,
the way it
you
is
know,
now.
then they got a long way to
Always
go.
evolving.
And I do get calls, you know, that want to talk to Bob and so forth, and of course, I'll patch them on to Lydia. And there are gonna be just a few of those seniors that don't wanna change.
Mhm.
You know, they will not change, you know, they wanna talk to that person, they don't wanna talk to a machine, you know, don't wanna hear a
So
machine.
they get my extension,
Yeah.
and they can call me directly for those
Yes.
types of patients, they just don't want to, but.
Well, and you know, the
And there's just a
pharmacies
few select.
nowadays will call you. I mean, they call you and say your prescription needs to be renewed,
Right.
you know, so it's, you know, it's, I don't know if that's helping them or hurting them because, you know,
Right, it's
so
just a lot of
doing it for them.
education.
And you know, when I misread my prescription bottle and I say I'm out of refills, oh, we'll call the doctor, at HEB, we'll call the doctor.
Right.
That's, I mean, they just.
And they will.
And
And they
back
also
to them.
send us the electronic file, and we can spit it back electronically,
Yeah.
so.
It's just educating them.
Any other questions?
I like that you're
Yeah.
changing the name to, I think that's wonderful.
Thank you.
Me too. Good job. We've come a long way
Oh, yeah.
on the call center, and
Yeah.
thank you for
Yeah.
your efforts very much.
And we're also taking all the calls now, did you say that? The specialists, all are rolling over,
I had told them,
urgent care is rolling over, so South Campus is rolling over pretty soon.
did you check?
So we're getting a lot of calls at the call center.
Okay. Good deal. All right, now,
Patient service.
our marketing
service.
update,
How many costs do you learn?
our marketing concierge.
Our chaplain Birdie has been doing a fantastic job with our spiritual service or spiritual needs here at the hospital. She has chapel service for employees and guests 3 times a week in the morning at 10:30. Her numbers average about 6 guests per chapel service, so that's great. We do get patients and family members in those numbers sometimes, so that's wonderful to see. She rounds to all of the clinical areas, upstairs, ICU, ER. She visits with patients and their families if they want her to. So she visits with about 8 patients and family members when she's here. And so the top number, she's given us 17 days of service just in a month. So she does a lot for us. She's also always available to our staff. They can always reach out to her, so she's had an average about 2 significant staff visits that she has helped them with something. This past weekend, she was called in to attend a patient's passing. She gave props to our dietary services. I don't know what the protocol is for a patient's passing, but she was in it, and she gave recognition to all of our departments in that. And you'll see at the last line, these comfort boxes, she knows the Board of Trustees for Sarah's Heart. Sarah's Heart is based out of San Antonio, and they offer services to women who have had fetal demise, miscarriage. And so these comfort boxes include materials, and she got those placed in the ER for us. So that was very big of her. On the 17th, Bob and Savannah attended the Senior Olympics. Senior Olympics is a opportunity for all of the nursing facilities, patients to have a little fun. So Bob handed out awards at that event. On that same day, you can imagine that all of our employees had a lot of fun with that.
I tried to go
We
retro.
tried to improve our image or
retro.
tear down?
This is this is Bob and Kyle out of their work clothes. The employees
It
loved
was a little
our
sunny that day.
yeah, our employees loved Ohio, the employees buying chances to have a shot. They raised $365 for Relay for Life. I still don't have the numbers for our final fundraising for Relay for Life yet. I hope to have that soon.
Well, please don't wear that to the beach.
Check the mirror before you walk out of the house. Your wife let you leave the house like that?
Camino Real Community Services hosted a Stop the Stigma mental health event, and we represented Family Practice Home Health and our wellness program at that event. And also with mental health, Paloma Place had their first anniversary in Wilson County, so we attended that event. They were kind enough to invite us. Conley did also have a team leadership team building opportunity for approximately 30 department heads. They all had a lot of fun bowling. And y'all know that Healthcare Services Group provides our environmental services. On this past Friday, the area executive chef Jonathan, I'm going to say Jednak or Yadnak, I'm so sorry, I don't know that. But he prepared a healthy meal for us. They had materials for community guests and also employees. So he answered questions about his healthy meal and talking about implementing healthier options for dietary. And they also had Luann, a registered dietitian, there answering any questions that of our guests had. Just last night, Savannah and I attended a content marketing in healthcare seminar in San Antonio. And we're going to move on to advertisements with Savannah.
So some advertisements we had in the newspaper this past month was the Lunch and Learn. We had about 15 guests in attendance, and 16 of them were not patients of Connolly, so those are 6 patients we have awareness of now of some services we offer. And she brought in the, what's that machine called, to show them the stroke.
Stroke robot?
Yeah, the white stroke robot. She just brought it in to show them, because we always talk about it, but for patients to actually see it, they were just amazed by that. And then we also had the cadaver lab in the newspaper. That was a real success.
I'm sorry, Cadaver Lab had barbecue.
Everyone came out. Each time there was a group that went into the cadaver lab, it was packed. We served them lunch, and it was really successful. So we were proud to announce that in the paper, along with Consolado. 2 advertisements that we had to place were notices of Chavez's retirement and Moorhead leaving the clinic. And then for Dr. Chavez, we did a retirement gathering that was very emotional and very nice. His clinic came out. A lot of the hospital people that worked with him for so many years came out. We gave him a little gift, but it was nice. He got very choked up. So Dr. First was implemented this past Monday. So we had Dr. First in sending text messages out to the patients regarding their refill, prescription refills and stuff, or anything regarding prescriptions. So we just built a flyer, and just so patient can have more patient awareness of Dr. First getting the text messages, and that Meditech, their portal, has an app. So we just rolled out some flyers this past week for patients who get discharged from ER and med-surg. And then some healthcare foundation events is the casino and the sports pay. We finally got both the flyers up, so you'll start seeing those flyers come around. And we have a blood donation coming up the 10th, July 10th. And this time, if you give blood, you get a free Whataburger and a free movie ticket. So it's a good incentive. We'll start promoting it pretty soon. Last month, Caitlin and I met with 4 to 5 different full-fledged marketing companies where they'll come down and do a marketing audit, and from there, if you like their marketing plan, you can go with them or not. And then this month, we met more with marketing software companies where we can just download a marketing software, and that will help us track any marketing efforts we do. So we're just looking at the full scale of different companies that can help assist us in generating more revenue and increasing patient heads through the clinics. So we just want to make sure we get everything right, all our ducks in line before I bring you any companies before. So next month we'll probably have some choices for you. And then some campaigns you'll start seeing is we have an award campaign coming up, which will probably add the 4-star, make it more clear. We have the call center. We did home health pass their inspection deficiency free, so we just did a little thing on Facebook, and we got so much great feedback from that, a lot of interaction. So Bob and I decided that any department who passes any type of certification, we will be promoting that because we feel like the community reacts well with that, and they like to know what's going on at Colony. So Henley passed his, and so tomorrow you'll see Henley be posted up on Facebook. Imaging's passing theirs, so we're going to be putting imaging pretty soon. You're going to be seeing the podiatrist campaign when he comes on, and then we're going to start seeing some pain, a pain campaign. So, and that's all I have for now. Any questions?
Thank you very much. Appreciate all you
Well, for the pain dog.
are doing.
Bring the pain.
You're not next.
Who's next?
Andy.
Mandy's back! Holy! I didn't get it.
CNO report, general nursing updates.
I did.
Did you put it back?
I did. There it is.
Well, mine's. Okay, so I wanted to give you all an update on who we are partnering with for educational opportunities in the community. I will be happy to announce that we will finally have our first partnership with Stockdale High School. 2019 to 2020, they are starting an EMS program within the Stockdale High School. So that's going to be pretty neat. David Rice is the director with District 3 EMS. He said he has talked to Lavernia as well, and I think they are going to try to do the same thing, but in 2020, 2021. They're not ready for that quite yet. So we're doing affiliation agreements and discussions on what that process is going to look. It's going to be about 8 to 10 students, high school students. So they will do their EMS rotation with District 3, and then they will do their clinical rotation with us and through the emergency room. And they have so many hours that they have to get. And by the time they graduate, they will be an EMT basic and be able to go out and start working. So that's really neat. I'm hoping the other high schools will follow through with that once school starts again. It's hard to get in to talk to some schools at the end of the year. So when school starts up again, I'm going to try to go make rounds again and kind of talk to them about, different opportunities. We had a success with Southside that came. That was our first high school, and we had 24 students that did rotations for patient care tech. And then she sent me a text that 20 out of the 24 passed their certifications, and the other ones just were off by a few points. So, like 5 points. So,
will they be able to test again? Or
I'm not sure. I didn't find out because I don't know if some of those were seniors or juniors. So I'm sure maybe if they're juniors, they have a process for that. If they were a senior, I'm not real sure. So, and they have actually, a few of them have applied with Connolly to be patient care tech. And they love their experience here, so that says something about that. Texas Department of Health. So we had a meeting, nursing team with our local community health nurse. She has a lot of resources. For instance, she found out we were doing the car seat drive safety check, and she says, hey, I have a lot more resources I can bring in kind of partnership with to do that, to educate the community. I think she has different sized dolls and stuff that you can put into the car seats. So we don't have to purchase those things. We can partner with them and utilize different resources to educate. Then Bear County Family Specialist, I'll be meeting with that regional director next week. She's contacted me, saw our flyer that Savannah and Caitlin went and distributed. And so I've had a lot of calls and a lot of emails of people who are just wanting to do partnerships. So I think that's really cool. And I'll find out with Head Start next week kind of what they're wanting to do. So I anticipate a lot of community partnerships in the future. The outreach education, don't forget, if you know anybody, tomorrow we have our second community CPR first aid AED. I have approximately 8 to 10, a couple signed up today, still have openings. I think what is pretty cool is this time, last time we had a lot of older adults who wanted to take it. This time it's younger, from like 15 to 23. So a few employees, children, and then other ones are just ones out in the community. They're excited to either get health care or they're either babysitting or lifeguards, something like that. And so they're really excited about it. And I think it's pretty cool that the younger population is signing up for this. So
What are the times on that?
It's 9 o'clock to, what did we, 2-ish, 3. Just depends. The guys that are teaching it are educators here, and I mean, this is their playground. If they want to stay longer, work with the dummies and mannequins and do stuff, they will. They just don't stop the class. So we said 16 and up. We have a few that are 15, and that's fine. I'm not gonna, turn them away. We just didn't want 8-year-olds running around. You can't really educate them to that level. So yes, if there's anybody else, we do have room tomorrow. Then June 30th is the car seat heat-related emergency stroke and trauma. We're gonna incorporate all of it. And like I said, the community health nurse will be coming out to join us for that. Then July 24th, we are inviting EMS, our in-house critical care nurses and respiratory therapy, to go over new standards of ECO2 monitoring. So it's just entitled CO2 monitoring. It's a new standard everybody should be doing. We're partnering with EMS to make sure that continuity of care, the patients coming in that need it and that we're sending out, we're all on the same page. And as the standards change, we try to incorporate the whole county of medical professions to be on the same page. So we'll have that on the 24th here in the West Conference Room. Now it's your turn.
Yes, sir. Yes, ma'am. And do you see anybody in the law pass for CHL? If you get CPR?
I don't know. I didn't look this week for CPR and your CHL license.
Thank you, Mandy.
Yes.
All right, I will now move to the CEO.
So in this month's CEO report, I just wanted to touch on some things. Harry and Nadine Chavez, of course, have retired, so we're working through that process too, of getting our patients aligned with our services through Dr. Henley, Dr. Peterson, Dr. Egmark, and our nurse practitioners. Dr. Eschenroder over the last month has been picking up. He was averaging, I think we've talked about that before, around 10 a day, and now he's averaging upwards of 16, many days at 19. So he's actually seeing some of those patients, and Dr. Henley's office is getting calls daily on those two as well, people moving their records there. And Egmark, we'll talk a little bit further on that, but he's working through his nurse practitioners there. The next subject is on Dr. Egmark. He is approaching his cap this month, if not capped out by now. We're getting some additional data for his contract. So Olivia and I and Dr. Egmark are vetting new nurse practitioners, and so that Dr. Egmark graciously has said he will see patients through his nurse practitioners. He'll go around and, as he says, kiss babies and shake hands and go around and talk to his patients and see his patients through his nurse practitioners through the next 3-4 months. So that could be some discussion for later. We're still continuing the pediatrician search. You sent me another candidate. Our last candidate chose to stay in San Antonio with another group. Remember, she was actually living in North San Antonio, and I think there were some just extenuating circumstances. Her husband was in the military too as well. I think they could be leaving within the next couple of years too. Podiatrist Travis Holloway has signed a contract with us and will be coming September 9th. We're excited. He's moving here. He's actually purchased, or he's in the process of purchasing a house in Poth. So we'll look forward to him coming down. We're working on that marketing campaign too as well for him.
Is he gonna be 5 days a week, or what?